Welcome to our short presentation on our new innovative skin booster called Elastic Lab. So before we dive into what exactly Elastic Lab is, it's very important that we have a little recap on skin anatomy. Now, we know that Elastic Lab is a skin booster, therefore is going to be injected directly into the dermis to stimulate both collagen and elastin formulation. So here, if you look at our diagram, we will know that the superficial layer of the skin is the epidermis. We then have the dermis, which does consist of both the reticular and the papillary dermis. And then we are in the subcutaneous tissue, and then we are left with the somates. So this is a very simple overview of skin anatomy. And as we age, we lose volume in the dermal layer. And this is because of loss of collagen, hyaluronic acid, if you like. Therefore, what we are trying to do is revitalize, replump, and rehydrate the dermis, thereby eliminating fine lines and wrinkles by using products such as skin boosters. So I've mentioned a few words like hyaluronic acid, collagen, and elastin. So let's have a very quick overview as to what they are. So hyaluronic acid is a molecule which in lay terms is called collagen, and it attracts water, i.e. it is hydrophilic and acts as an antioxidant. Collagen is the main protein in the extracellular matrix, and type 1 is the most common, and there's various types. And elastin is a protein which allows stretch and recall of the skin. Now, what exactly is Elastic Lab? So it's a novel dermacare system which focuses on extracellular matrix regeneration. And the main two compounds that we are looking at here is elastin and collagen. There is also some long-lasting hyaluronic, which basically revitalizes and hydrates the skin. And this also induces a connective enzyme activation, which I will show a diagram later on. So ECM is an abbreviation for extracellular matrix. It's a 3D network of macromolecules such as collagen, elastin, and glycoproteins. It provides structural support and biochemical regulation of the surrounding cells. What is the role of the ECM? Well, the physical role is to support and connect tissue. It acts as a physical boundary. It forces absorption and elastic recovery. What is the biochemical role of the ECM? Well, there's various roles, such as regulating proliferation of cells as well as migration, intracellular metabolism, cell differentiation, and morphology. So what happens to the ECM as we age? Well, here, if you look at the diagram, on the left, we have various collagen, elastin, and hyaluronic acid molecules. And as time goes on, i.e. as we age, they reduce in number. Therefore, you lose the volume, the elasticity, and the hydration properties of the skin. So elastin. Elastin is the key protein of the ECM. It's a very highly elastic molecule which is present in connective tissue, and it allows the tissues to resume their shape after stretching or contracting. If you look at this diagram over here, here at the top we will have an intact elastin network which are cross-linked. So you have a very strong network of elastin. And certain enzymes or proteases will basically cause this to degenerate. And this is why we end up with degraded elastin network. So you can see the structure is pretty much demolished compared to the original framework up here. Now, As we age, elastin is subject to remodeling and fragmentation. So it is important to keep that in mind because we are limited in terms of the stretchability and the recoilability of the skin as we age. So what are the ingredients of our Elastic Lab Skin Booster? Well, in one of these boxes, you have 5 vials, and each vial contains 3.3 mils of Skin Booster. Now, the main ingredients are amino acids, minerals, and hyaluronic acid. Amino acids will help reconstruct the ECM by inducing elastin and collagen. Hyaluronic acid biorevitalizes and hydrates the ECM with its hydrophilic properties. Functional minerals activate the connective enzyme cascade within the ECM. So what are the common treatment areas? Well, the common treatment areas would be the face, neck, hands, and under the eyes. Areas outside of the face and neck would include places such as the knees, the arms, and the décolletage. What are the indications? So fine lines and wrinkles, loss of skin tone or elasticity, dry, dehydrated skin, acne scarring, sun damage, sunspots, age spots, and dark circles under the eyes. The protocol for injection, which you will see in the attached videos shortly, is quite simple. There are 4 treatments in one cycle, and one treatment is done every 7 to 10 days, which will be repeated 4 times, and that will be one complete cycle. And then this cycle is repeated every 6 months. Now the injections are going to be into the mid to deep dermis. They are done with 0.1 ml aliquots or bolus injections. You may also use a meso gun if you have this in your practice. Now, the video will show you how to quite simply use Elastic Lab Neat as a skin booster. Alternative options will include blending Elastic Lab with skin boosters such as Hyaluron, which we will also demonstrate. And another option is to combine Elastic Lab with a small amount of botulinum toxin. So we will now move on to complications. So as with anything, there is never a treatment which is 100% entirely risk-free. So common complications will include bleeding, bruising, hematoma. There may be some swelling or redness, especially post-treatment. Infection is very uncommon. And furthermore, even more so, which is quite uncommon, is vascular compromise. Therefore, it's very important to make sure that you know what the underlying anatomy is and appreciate injection depth. Thank you very much.